Now, I want to centre our conversation around quarantine. Hotel quarantine has been so successful in Australia, but we're starting to see the cracks appear. Now we're, a year into or more, year into coronavirus infection right around the world. What adaptations do we need to make?
Look, hotels were never designed for being quarantine stations. Their ventilation isn't very good. You can't open windows, and they're right in the middle of cities, which is not ideal. So if I was in charge of the country, I'd be setting up remote areas to put quarantines in.
OK, let's talk about that, because there are some practicalities that come along with regional quarantine. I mean, there are questions over how you get a workforce there, whether they could be acquired locally. And if they're not acquired locally and the workforce had to travel from a major city, wouldn't that kind of increase the risk of spread?
But one of the troubles is that the current workforce working in the quarantine hotels aren't paid very well. What should happen is they should be paid a lot of money to work in remote areas, just like people working in mining camps. So if you're a cook in a mining camp, you probably earn $100,000 a year. So I think that they should be paid extremely well, and that would encourage people to work in these remote settings.
OK, so you pay people an extraordinary amount above what they would normally be paid. They live in these regional communities. But are you worried about the capacity for these regional communities to deal with an influx of people, a huge temporary increase in their population?
Well, it could actually be remote rather than regional. So we've got Howard Springs, which is far enough away from Darwin that we could call it remote. We've got all sorts of other places in Australia that could be used, like Woomera. So yes, is the answer. I feel it could be done and should be done. Why
regional areas as a piece of medical advice? Is it the risk of transmission through aerosols that can be allayed?
But it's not just how it gets transmitted. Well, what we've seen, let's start off by saying we know that aerosols are becoming more and more important, particularly with the new, more transmissible variants, the new contagious variants. But the issue here is that we cannot stop these leaks. We've tried, and we're seeing them time after time again. Now, if it was a remote area, it wouldn't matter. There would be a few people infected, but they'd be in a remote area that they couldn't spread it to a very large community. But when you've got the Medi-Hotel in a city, so you've got the staff working there, commute, usually by public transport, back to their families, then the whole thing breaks out like it did in Melbourne. So the whole object of having these quarantine stations in remote settings is to separate out the sick from the healthy. And you can't do that in the middle of a city.
Can changes be made in the middle of the city to air conditioning, to the way passengers or quarantine passengers are spaced out? What improvements could be made if this city hotel quarantine system does continue?
Well, look, the South Australian government has just commandeered a hotel in Adelaide where they're going to put all positive cases. And they've had to retrofit the ventilation to make sure it has good ventilation. It's got windows that open and balconies. So, yeah, if you can find suitable places, it's safe from that point of view. But it's still in the middle of a city, and so if there is an escape, it can happen.
It seems his latest outbreak has been down to the use of a nebuliser. You find it crazy that someone allowed someone to use a nebuliser in hotel quarantine?
Well, it's all very well sort of saying this shouldn't have happened. But I mean, we can always think, oh, we should have done this, we should have done that. But it's only now that we're realising this could have happened. So we know that the use of nebulizers and CPAP machines, etc., to spread aerosols around. And so, yes, it shouldn't have happened. That person shouldn't have been using it. But some people need them to live. They've got severe lung infections. They can't do without them. So I'm not sure how you could manage that. Perhaps if you had someone in that situation, then all staff would have to wear full PPE.
Interestingly, with this use of a nebuliser, has it put the spotlight on other aerosol uses within these rooms? I mean, I'm thinking of asthmatics that use a puffer. I'm thinking of probably more women that use hairspray. Do the use of extra aerosols create any kind of extra risk?
No, I shouldn't think so. With the nebuliser, what's happening is that the infected person is breathing in the sort of vapours, and then that has to be ejected. And once that's ejected, then goes into the air. So it's the vapours that carry the virus particles that are the important thing. if you're using hairspray, it won't have virus particles in, so no, it's not the same.
Okay, Adrian, we just got some breaking news here. 2 new cases of coronavirus have been detected in Melbourne, in Victoria, overnight. This is a growing cluster. How concerned are you about this now?
Obviously, I'm very concerned, especially if it's the UK variant, which we don't know yet. So this really has to be brought under control extremely quickly, especially if it's the UK variant, because it has the potential to really take off even worse than the previous big Melbourne outbreak.
It has been confirmed that one of the cases linked to this cluster is indeed the UK variant. What would your advice be to government now in terms of any lockdowns or extra precautions?
I think the government has to seriously now consider lockdown and really ramp up their contact. I'm sure they're doing this anyway. They'll be ramping up their contact tracing, doing the close contacts and the close contacts of the close contacts. So that's a sort of second ring fence around anyone who's potentially exposed. And then any more cases, and I think it's going to have to be a lockdown again.
Just finally, Adrian, Esterman, we saw a couple of days ago Daniel Andrews saying that he thought his hotel quarantine system was more superior than other states, but we now know that he's had an outbreak of more clusters than anywhere else in Australia. What do you put that down to?
Look, no hotel quarantine system is safe because they're staffed by humans and humans make mistakes. That's all there is to it. So no, the Victorian system is probably better than the other states because they have more rules in place about testing, etc. But none of them are safe and they shouldn't be in the middle of cities.
Adrian Esterman, really appreciate your time today.
Not a problem. Nice to speak to you.